Well, doctors are starting to see an increase in cases of influenza as the state sees fewer people getting their flu shot this year. News 8's Kyle Mitchell is in the studio with what you need to know to reduce your risk. Kyle.
Amber, infectious disease doctors say it's not too late to get your flu shot and that flu can lead to serious complications for some patients. With cases of flu on the rise,
we are absolutely seeing it start spiking up a little bit. It starts as a trickle, and then unfortunately it starts going a little bit faster.
Dr. Andrew Jamieson, the regional division head for specialty medicine and an infectious disease doctor with Trinity Health, says he's already treating patients with serious complications.
This is not something to downplay. It's not something you want. And actually, there are people in the ICU right now that I saw this morning that had what we think was influenza, and then they got a really bad bacterial pneumonia afterwards and are super sick in our ICU.
Data from the Michigan Department of Health and Human Services shows flu vaccination rates are down just over 17% from last year. Nearly 2.4 million Michiganders have received their flu shot, which is short of the 4 million goal.
From an infectious disease perspective, it's discouraging because that just increases the chance that someone's going to get more severely ill. There's a chance that we're going to see them in the hospital more, and then there's also a chance they're going to transmit to family and friends easier.
Dr. Jamieson says a variety of factors may be contributing to the drop.
I think we're all experiencing that COVID hangover still. It's harder and harder to talk about vaccines with people. We're just sick of hearing about respiratory viruses, but the reality is they're still here, and you don't realize it's going to hurt until it really does. And so I would just encourage people that it's not too late.
If you get the flu and had your flu shot, doctors say it still provides some protection.
The fact that flu vaccine does things, even if it doesn't stop you from getting infected, is super huge. So what we see is that you have symptoms less, they're not as severe, you don't get hospitalized as much, and you don't spread it as much to family members.
How close of a match the vaccine is to the strain circulating isn't clear at this point.
We call that the viral efficacy, and that's basically saying, if you got the vaccine, how likely are you to get influenza? We won't know that till the end of the season.
As people gather for the holidays, doctors are reminding them to take precautions if they feel a little sick.
Just put on a mask and still see family. Don't throw it out completely. I don't think we have to completely ruin Christmas, but just be considerate of those around you.
Dr. Jamieson says it takes a couple weeks for the flu shot to give you the most protection, but even having it for a few days before getting infected can make an impact. Amber?